Audible. So in this session we are going with the discussion of another important topic targeting for your examination, triangles of neck MCQs. Okay, so it is an important topic, so let me just check, am I audible, is the screen clear, so that we can start the session. So let me just check. So yes, I am audible. Yes, I am audible and everything is fine, so we can start the session. So I will discuss exactly the MCQs, and then only there itself I will give the explanation and we will complete this topic, important MCQs of the previous year about this topic of triangles of neck. So before starting the session, Dr. Monalisa, MD Anatomy from Armed Force Medical College, Pune. I am here to discuss the MCQ related to the topic. So let's talk about the special class features. When I am talking about the special class feature, it's an interactive session where the learners and the educators can interact. Polls are conducted among the learners and you can raise your hands, get your doubts clear, write itself in the session, get notification of the session, of the upcoming session, which is taken by the educator. So what will happen, you will get notification regarding all the sessions taken by that educator. It will be highly beneficial for you. Now download the PDF notes once the session is finished, anytime, anywhere, read from the top educators of Unacademy platform. This is another important features which all can be targeted by you. Now crack NEET PG Compact. When I am talking about crack NEET PG Compact, which is going to happen on 19th Feb. So today is 18th Feb, tomorrow the test is going to happen. Be present for this test. This is the test, timing is 6 p.m. Enroll in this test by using the code ANAT10 and do present for this test. This will be highly beneficial. Orthopedic, obs and gynae, surgery and pediatrics MCQs will be discussed. Will be done, and you have to you have to give the test and you will get exciting prizes. So NEET PG mock test, which is going to happen on 26th Feb 9 a.m. So again you can use this code and you can be present for this test. This will be again highly beneficial for you. So my dear aspirants, again exciting prizes and solution will be given for all the MCQs by the top educators of Unacademy platform. Video recorded, video solutions live. Plus subscription, all 19 subjects are completed in a very systematic way. You can study from India's top educator, you can compete in live tests and quizzes, you can study on the device of your choice, and you can assess more than 25,000 MCQs. So these are highly beneficial, and these are all 25,000 MCQs are clinical MCQs, which is on the recent topic of recent advancement and clinical MCQs of all 19 subject, recent pattern of MCQs, and a video recorded. You will get also a detailed explanation or by the top educators of Unacademy platform. So be present for this session, and it is highly beneficial. You can have the recorded and also the live version of all the sessions, complete version of the classes. Iconic subscription, the benefits of the Unacademy is added on with the prep ladder. So already talked about the benefits of plus course of Unacademy. Along with it, you get the benefits of clinical integrated essentials, video lectures from the dream team, QBank 3, active guidance system, stacks, revisions, snapshot, treasure, dream notes. So all these can be assessed by you. Use the code ANAT10 and get 10% discount if you want to take the subscription. But right now 20% discount is going on. I will tell you that offer also. Unlock 20 for all the Unacademy subscription, which is valid till 19th of Feb. Till 19th Feb, Unlock 20 is valid. So unlock 20% on all the Unacademy subscription. Again, this is highly beneficial. Congratulations to the toppers of FMG December session 2021. This is again beneficial, and my dear aspirants, actually I want to congratulate the topper of FMG December session 2021. I wish them best of luck. I am very glad to share their image, and I want that they can clear their next exam, NEET exam, in the first attempt. Now this is the whole detail of the Unacademy test which you have to, this is the whole detail of anatomy test series, which is educator curated test series targeted for the medicine, that is for the orthopedic, pediatric, surgery, biochemistry, and all these can be assessed by you. So you can enroll in these free tests made by the top educators by using the code ANAT10. Also NEET PG all educator revision batch, subject wise batches, target subject wise batches, focus FMG batches, comprehensive batches. All these batches can be you can join these batches, you can take the subscription, you can use my code NAT10. Discounted rate is now going on, unlock 20 is going on. So till 19th Feb, use this code, means till tomorrow, and take the subscription. Now let's start with the MCQ. Okay, which of the following is not correct in respect to posterior triangle of neck? My dear aspirants, please mark the correct answer. Which of the following is not correct in respect to posterior triangle of the neck? Its anterior border is formed by posterior border of sternocleidomastoid muscle. Its posterior border is formed by anterior border of trapezius muscle. Its inferior border is formed by middle third of clavicle. Its roof is formed by platysma. Its floor is formed by muscles covered by prevertebral layer of deep cervical fascia. So what is the correct answer? Which of the following is the correct answer? Your time starts now. Please mark the correct answer. Which is the wrong statement? Which is the wrong statement? So my dear aspirants, here D is the wrong statement. Its roof is formed by platysma. This is not correct. Okay. So my dear aspirants, it is important for you to know that which layer of deep cervical fascia is forming the roof and which layer is forming the floor. All other options are perfectly correct. I will show you the posterior triangle and boundaries. Here I just want to tell you two key points. Please note down, when I am talking about the roof of posterior triangle, the roof of posterior triangle is formed by investing layer of deep cervical fascia. Investing layer of deep cervical fascia. Okay, and when we are talking about the floor is formed by prevertebral layer of deep cervical fascia. Prevertebral layer of deep cervical fascia. Okay, so exactly D is wrong. Now see here the boundary. I would also like to show you this diagram where you can appreciate the boundary. So let me just enlarge this diagram where I want you to show the boundaries of the posterior triangle. So here you can see, if I talk about the boundaries of posterior triangle, this is exactly what I am highlighting here is the posterior triangle. So what would be the boundary here? So anteriorly it is bounded by this muscle. This is sternocleidomastoid muscle. Posteriorly it is bounded by trapezius muscle. Inferiorly it is, or its base or inferior aspect, it is bounded by middle 1/3 of the clavicle. Middle 1/3 of clavicle. If I talk about the apex, it is towards the occipital bone where the sternocleidomastoid and trapezius muscle is meeting. So this is the boundary. Okay, and you can also appreciate here, if I just want to show you this this muscle belly. This muscle belly is inferior belly of okay, this muscle belly which you are seeing here is the inferior belly of omohyoid muscle, and inferior belly of omohyoid muscle is dividing it into upper occipital triangle and lower subclavian triangle. Okay, so upper triangle is called as occipital triangle and lower triangle is called as subclavian triangle. So upper triangle, this is the occipital triangle. Below the, so this is above superior belly of omohyoid. Below the superior belly of omohyoid, we have got subclavian triangle. Done? Now let's move on to yes, doctor, pristine. Let's move on to the next one. Now before that, the same thing I have written also, so that you can revise it, so that you can also have the revision of it. Posterior triangle of the neck, anterior border is formed by, if I talk about anterior border, it is formed by posterior border of sternocleidomastoid muscle, posteriorly by anterior border of trapezius muscle. Inferior border by middle 1/3 of clavicle, apex where the two trapezius and sternocleidomastoid muscle is meeting at the superior nuchal line of the occipital bone. Roof is formed by investing layer, floor is covered by prevertebral layer of deep cervical fascia. All these information about the posterior triangle, boundaries, roof and floor. Let's move on to the next one. Question number 2. Anterior triangle of neck does not contain which of the following smaller triangles? Anterior triangle of the neck does not contain which of the following smaller triangle? Supraclavicular triangle, submandibular triangle, submental triangle, carotid triangle or muscular triangle? I got an answer from Krishna SRA, Dr. Pristine A, supraclavicular. Okay. Okay. So, my dear aspirants, you are absolutely correct. Yes, we know that anterior triangle is again divided into 4 triangles, and these, okay, Naveen, you are also correct. And this anterior triangle is subdivided into 4 smaller triangles, which is the submandibular triangle, also called as digastric triangle, the submental, carotid and muscular triangle. I would like to show you that division. So, see here. So, again I want to enlarge this image and I want you to show the division of anterior triangle into subsequent smaller triangles. Is it okay? Yeah. So, let us not focus on posterior triangle now. Now, our target is anterior triangle. The overall boundary will be the lower aspect of the mandible, the anterior neck line, neck midline, posteriorly by the sternocleidomastoid muscle. Okay. So, this black outline which I am showing you is the overall anterior triangle boundary. Inside it we have got smaller. Okay. Inside it we have got smaller triangles. Okay. So, here you can see the triangle which is shown by the pink color here. This triangle is the submental triangle. So, this is the submental triangle. So, submental triangle, if you will see, it is bounded between, it is bounded below by the hyoid bone, above by the it is actually bounded by anterior belly of digastric. So, it is actually lying here below the mandible mental region here, and it is bounded on either side by the anterior belly of digastric. Now, here, now we were talking about the green color triangular area, that is submandibular triangle, which is also called as, this triangle is also called as digastric triangle, which is bounded by the anterior belly of digastric, posterior belly of digastric and stylohyoid posteriorly. So, it is bounded by which all muscle? Posterior belly of digastric and stylohyoid muscle, and anteriorly by anterior belly of digastric. Okay. Below we can see the hyoid bone, below we can appreciate here the hyoid bone. Now, let us talk about carotid triangle and that of, let us talk about this carotid triangle which is shown with the blue color. So, this is the carotid triangle. The boundaries of carotid triangle is, lower down it is bounded by, lower boundary will be the superior belly of omohyoid, and above it is bounded by and posterior belly of digastric and stylohyoid muscle. Posterior belly of digastric. So, actually we have got here posterior belly of digastric and stylohyoid, which is lying the boundary superiorly, and below, that is posterior inferiorly, we have got the omohyoid inferior belly. Posteriorly it is bounded by sternocleidomastoid muscle. Now, the yellow color muscle which is lying close to the anterior neckline, muscular triangle, which is bounded by the anterior mid-neck line, anteriorly mid-neck line, posteriorly sternocleidomastoid, posterior inferiorly sternocleidomastoid, posterior superiorly superior belly of omohyoid. So, this is the 4th triangle which is lying inside the anterior triangle. So, done. Let us move on to the next. Anterior triangle contains submandibular, digastric, carotid, submental and muscular triangle. Posterior triangle contains 2 triangles, that is occipital and subclavian triangle, supraclavicular triangle. So, posterior triangle and subdivision we have seen in the first MCQ. Let us move on to the next. Question number 3rd. Which muscle is contained in the posterior triangle? Which muscle is contained in the posterior triangle? Options are splenius capitis, levator scapulae, middle scalene, posterior scalene or stylohyoid. Which muscle is not a content of posterior triangle? Which of the following muscle is not a content? Okay, so all of you just waiting for 15 seconds, 13 seconds, I will move on with the explanation. Naveen has given the answer E. What about others? Naveen has given the answer E. What about others? So yes, Naveen, you are perfectly right. Yes, stylohyoid is not forming any kind of posterior triangle content, boundaries, floor. Rest all muscles, splenius capitis, levator scapulae, scalenus group of muscle is forming the floor muscle of posterior triangle. Let me show the image. So my dear aspirants, floor muscles are covered by which layer of deep cervical fascia? Floor muscles are covered by which layer of deep cervical fascia? Prevertebral layer of deep cervical fascia. It is covered by prevertebral layer of deep cervical fascia. Floor muscle. Floor is covered by, floor of posterior triangle is covered by prevertebral layer of deep cervical fascia, and the superior most, yes, Farhad, Parvez, you are right, superior most muscle, if you will see, which is having vertical fibers, is the semispinalis capitis, most superior most, and lower to it we have got splenius capitis muscle. Next to it we have got levator scapulae muscle. Next to it we have got scalenus. Next to it we have got scalenus medius muscle, and also we have got the fibers of scalenus posterior and that of anterior muscle. Sometimes also first digitation of serratus anterior. So very clearly you can see stylohyoid is not giving any contribution in forming the floor muscles of posterior triangle. Okay, so let's move on to the next, that is posterior triangle. When we are talking about posterior triangle, it contains semispinalis capitis, levator scapulae, middle scalene and scalenus posterior muscle. Yes, line diagrams, Dr. Pristine is very easy to understand. So at times we can use line diagrams also. Let's move on to question number 4. A 43-year-old woman came with a large abscess . Large abscess in the middle of the right posterior triangle of the neck. The physician incised and drained the abscess. 5 days later, the patient noticed that she could not extend her right hand above her head to brush her hairs. Which of the following are signs and symptoms of additional harm? Okay, question number 4, please mark the correct answer. According to you, which is the right answer? It is a case, so the key point is incision and drainage, my dear. The incision and drainage which is given by the physician is approaching to which area? So the incision and drainage is of the abscesses in the posterior triangle of the neck, that is giving you the key hint here. Okay, so Sharath Krishnan has telling C. Okay, so and later 5 days she could not extend her right hand above to brush her hairs. Sign and symptoms. Yes, my dear aspirants, you are perfectly right. The correct answer is cut to spinal part of accessory nerve. So yes, spinal part of accessory nerve is giving innervation to two muscle. One is sternocleidomastoid muscle and other is serratus anterior muscle. So here the key point of not extending the arm above the brush like this. So we can brush like this our hairs. So this is overhead abduction. Overhead abduction. So here what is involved? So overhead abduction is not possible. So in this case overhead abduction is not possible, and we know that overhead abduction is done by serratus anterior muscle and that of, so it is done by serratus anterior muscle and trapezius muscle. Now here the nerve which is injured is spinal accessory nerve, because in posterior triangle of the neck spinal accessory nerve is involved. It is giving innervation to two muscles, sternocleidomastoid and trapezius muscle. The muscle paralyzed here is trapezius muscle. So the key word is large abscess in the middle of the posterior triangle of the neck. Physician incised and drained the abscess. She could not extend her hand above the head. So posterior triangle is an anatomical region, as we know, where an important structure is injured is the spinal accessory nerve, which is an important content of posterior triangle. The reason why it is injured is it is traversing between the roof that is made by investing layer of deep cervical fascia and floor that is made by the prevertebral layer of deep cervical fascia. Yes, Sharth Krishnan, you are absolutely right. Boundaries, you can, those who have not revised, they can see the boundaries. Here they can see the boundaries of posterior triangle. Anteriorly by sternocleidomastoid muscle, posteriorly by trapezius muscle. below is the clavicle, middle 1/3. Apex is above at the superior nuchal line of the occipital bone. And then we have got, now all the significant contents of posterior triangle is basically having carpeting of the floor. Yes. So the spinal accessory nerve location is between the roof and floor. What I told you, spinal accessory nerve is exactly between the roof and the floor. So this is the reason the spinal accessory nerve can be compressed. Exactly, the spinal accessory nerve is traversing between the roof and floor. That means in between investing layer and prevertebral layer of deep cervical fascia. In between prevertebral layer and investing layer of deep cervical fascia, which nerve is traversing? Spinal accessory nerve, that is the 11th cranial nerve. So it will be compressed. So that is the reason it will be compressed. Now, spinal accessory nerve, after piercing the posterior border of sternocleidomastoid muscle, it traverses downwards laterally parallel to levator scapulae, and ultimately it supplies trapezius muscle. Action of trapezius muscle. So that is clear that the two muscle getting injured is the trapezius muscle and sternocleidomastoid muscle. The other option which is wrong, damage to scalenus medius, is wrong. Why, my dear aspirants? Scalenus medius muscle is causing elevation of first and second rib. It is not causing elevation of arm overhead abduction. It arises from cervical vertebra, inserts into the first and second rib, and cervical nerve C3 and C8 is giving innervation. So quickly you can revise the origin, insertion, action, nerve supply of scalenus medius. The more concerned point is that its action is elevation of first and second rib, and here the elevation of it's actually the action which is lost in the patient is overhead abduction, not the elevation of first and second rib. Suprascapular nerve is again the wrong option. Why? Because we know that suprascapular nerve is giving innervation to two muscle. One is supraspinatus, other is infraspinatus. So the action of supraspinatus is initiation of abduction. So initiation of abduction means 0 to 15 degree of abduction. So this is wrong, because in this case overhead abduction is involved. In the case overhead abduction is involved, which is above 90 degree. It is not 0 to 15 degrees involved. So this is not. Infraspinatus. What is the action of infraspinatus? It is causing lateral rotation of arm. It is causing lateral rotation of arm, and lateral rotation of arm was not lost here. Yes, shrugging of shoulder also. Yes, Sharth Krishnan. See here, supraspinatus abduct 0 to 15 degree, infraspinatus lateral rotation or external rotation of arm will be affected. Spread of infection to shoulder joint. If the spread of infection from shoulder joint reaches to axillary region, it will involve the axillary sheath by the continuation of prevertebral layer, and this will involve overall the whole axillary region. So exactly not the spinal axillary. So that means it will involve axillary veins, cords or brachial plexus. So this is not the right answer. Let's move on to the next question, number 6. Following a procedure on right side of the neck, a patient is no longer, so it is again very easy, correlated with this MCQ, no longer able to raise his arm above horizontal position and not shrug the shoulder. So yes, Krishnan, your question came, shrugging of shoulder is involved. So nerve involved is, which is the nerve involved? You are already getting the answer. So all of you can mark the right answer. Please give the right answer. Yes, Sharth. It's the spinal accessory nerve. So you can see just the language of MCQ has been changed, and the MCQ is similar. Spinal accessory nerve is involved. Absolutely correct, Naveen and Shravani. Spinal accessory nerve we have just not talked about. It is an important structure to be compressed in posterior triangle. So yes, we have done with this. Other option, axillary nerve is giving innervation to deltoid muscle. Okay. So it is not the right answer, and auricular nerve and great occipital nerve is giving innervation to the region. So let me show you. Axillary nerve is deltoid muscle, which is, and teres minor, which is not causing overhead abduction. It is causing abduction from 15 to 90 degree, deltoid muscle. Great auricular nerve is a branch from cervical region. It is also coming out, sprouting from the roof of the green color roof is the investing layer of deep cervical fascia, but it is not giving innervation to any muscle. It is not giving innervation to any muscle. So great auricular nerve is not the right answer. So just ruling out the incorrect option. Great greater occipital nerve. So great auricular nerve, also the greater occipital nerve is not the right answer. Again, it is the dorsal ramus of second cervical nerve, and it is also not giving innervation to any muscle, so it can't be the right answer. It is giving innervation to the skin on the back of the head. It is giving innervation to skin on the back of the head, so it is again not involved in overhead abduction. Yes. No, Sharth, you are right. Axillary nerve and teres minor. Axillary nerve and teres minor. Pectoralis minor is getting innervation from medial and lateral pectoral nerve. Sharth, it is medial and lateral. If I am talking about axillary nerve, it is deltoid. Deltoid and teres minor. Yes. Question number 7. A patient has been severely injured in the back of the head during a mugging attempt, and imaging study reveals possible fracture of the skull along with the involvement of first atlas cervical vertebra. The patient is also hemorrhaging from the vertebral artery in this location, and the attending surgeon will attempt to stop the bleeding by assessing the sub-occipital triangle. Which of the following muscle attaches from the transverse process of C1 to the occipital bone and forming lateral border of sub-occipital triangle? So that means this MCQ is talking about, it is talking about the anatomical relations, anatomical boundaries, contents of sub-occipital triangle. So it is asking about lateral border of sub-occipital triangle. That means the whole clinical history is about the sub-occipital triangle. Those who are knowing the boundaries, the content, they can mark it right. So which of the following is the lateral border of sub-occipital triangle? Anyone wants to give the answer? So that means I have to explain the sub-occipital triangle for marking the correct answer. Question number 7. So please mark the correct answer, dear. Your time starts now. No. Sub-occipital lateral border is formed by obliquus capitis superior. Okay. So we have got obliquus capitis superior as the right answer because it is forming suprolateral border. It is forming suprolateral border. Rectus capitis posterior major is forming supromedial border, dear. And obliquus capitis inferior is forming inferior border. It is forming inferior border. It is forming inferior border. So let me explain it. So yes, I got a correct answer from, I think, no, it's no one has given. So don't worry, I will explain. Sub-occipital region. Please note down the boundaries of sub-occipital triangle. So actually sub-occipital triangle is a region on the neck on the posterior aspect, and the sub-occipital group of muscle is forming the boundaries. So what I told you, rectus capitis posterior major is forming supromedial boundary. Obliquus capitis superior is forming the boundary above and laterally, that is suprolateral. So this was asked in the MCQ, and this is the reason it is the right answer. I will show you the image also. Oh, image also. Okay. Farad Parvez, no, obliquus capitis inferior is not the right answer. The reason is that obliquus capitis inferior is forming inferior border, inferior border. We are talking about lateral border, above and lateral. So obliquus capitis superior is the right answer. Now see here, let me enlarge this. All of you see this image and you can see the correct answer. Let me explain it. Okay, so my dear aspirants, this is the sub-occipital triangle. Obliquus capitis, so please focus on obliquus capitis inferior muscle. This is the obliquus capitis inferior muscle. It is forming inferior boundary. Can you appreciate? It is forming inferior boundary. Obliquus capitis superior is forming suprolateral boundary. It is forming suprolateral boundary, this muscle. And this is the rectus capitis posterior major lying close to rectus capitis posterior major. This is forming supromedial boundary. This muscle is forming supromedial boundary. Okay. So that means supromedially rectus capitis posterior major is forming the boundary. Suprolaterally obliquus capitis superior, obliquus capitis inferior is forming inferior boundary. This is the boundary of sub-occipital triangle. Done? Now let's see here. Actually, I want to show you the roof. So if I enlarge this, firstly let me show you the enlarged one. diagram. So if I show you the enlarged diagram, you can see semi-spinalis capitis has been dissected out so that you can see this triangular area having 3 muscles, as you can see here. Obliquus capitis superior, this is supralateral boundary. Obliquus capitis inferior, inferior boundary. And rectus capitis posterior major forming supromedial boundary. Now, here you can see the muscle which has been cutted out is semi-spinalis capitis. So, semi-spinalis capitis is forming the roof of sub-occipital triangle. It is forming the roof of sub-occipital triangle. The content. So, my dear, can you appreciate the content inside? So, can you appreciate the red color structure residing inside? This is the vertebral artery, to be more specific, third part of vertebral artery, and also the nerve which is seen inside. The nerves are traversing, and this nerve is sub-occipital nerve. So, the content will be sub-occipital nerve, third part of vertebral artery. These are the contents along with the sub-occipital venous plexus. Yes, Sarth. It's the content is sub-occipital nerve, vertebral artery. So, the content will be vertebral artery, third part, sub-occipital nerve, and sub-occipital venous plexus, and sub-occipital venous plexus. Please write down. Now, so we have done with the content. Now I want you to show the floor. The floor is formed. So here the content is also shown. The content is also shown here. The content is third part of vertebral artery, which shown with the red color, and the floor structure. The floor is formed by 2 structures, and these 2 structures are, the floor is formed by posterior arch of first cervical vertebra and posterior atlanto-occipital membrane. So write down. The floor of the sub-occipital region is formed by posterior arch of atlas and the posterior atlanto-occipital membrane. These 2 structures are forming the floor of sub-occipital triangle. Now the contents. The contents are third part of vertebral artery, dorsal ramus of first cervical nerve, and the sub-occipital venous plexus. These are the 3 contents of the sub-occipital triangle. Third part of vertebral artery, dorsal ramus of first cervical nerve, that is the sub-occipital nerve, and also the sub-occipital venous plexus is the content. So is it okay? Have you understood? Please give me a thumbs up if yes. At times it also forms a site for collection of CSF and compression. Yes, you are right, Sarth. So everyone, is it okay? Have you understood today's topics and MCQs? Okay. So my dear aspirants, tomorrow I will take special classes also, and do present in the special classes. I will take sessions 12 p.m. I will take, and 1 p.m. I will take special classes. So do present live for this session, 12 p.m. and 1 p.m. Is it okay? Tomorrow 12 p.m. and 1 p.m. please be present for these sessions, 12 p.m. and 1 p.m. Use the code NAT10 to unlock the free sessions of Unacademy. Okay, so let me give you another information. Unlock 20, you can have the opportunity of taking the plus subscription on a discount of 20% of all Unacademy subscription. My dear aspirants, use my code NAT10 and take 20% of discount. If you are planning to take the subscription, this is the right time, go for it. Also, the discounted rate of is given, so you can just pause this video and you can enlarge this image to see the discounted rate of the, this is the highest discounted rate which is applicable till Feb 19. Till Feb 19, go for it, use the code NAT10 and avail the opportunity of 20% discount. Thank you, Naveen. 20% discount on all subscription. NEET PG Compact is tomorrow, that is 19th Feb. Go for it. Use the code NAT10 to enroll and win exciting prizes. You can win exciting prizes, dear. Enroll by using code NAT10 for tomorrow's 19th Feb, 6 p.m. is the timing. Do enroll by using the code NAT10. Also, I want to remind you of 26th Feb, 9 a.m. is the timing. All India 2022 NEET PG, All India mock test on the pattern of NEET PG examination. Don't miss this session. Be present. and enroll by using the code NAT10. This will give you a filling of the main exam. You will be also provided with the solution and conceptual and clinical learning, and video solutions will be given by the top educators of Unacademy platform. Use the code NAT10 and do present for 26 Feb 9 AM NEET PG 22 All India mock test. Enroll by using the code NAT10. Before ending, thank you. Do subscribe, like. Let's crack NEET PG platform. And I would also like to tell that once the session is finished on the special classes, download the PDF notes. This will be highly beneficial. Use the code NAT10 to take the subscription till tomorrow, and avail the opportunity of 20% discount. Use the code NAT10. All the best. Keep studying. Thank you so much. We will again meet with upcoming sessions. Thank you.